Thank you, Dr. Clark. Good morning, everybody. It's good to be here in Newark. Buenos días, un placer estar aquí en Newark, en el Centro de Salud de Newark, una de las agencias más importantes de la salud en nuestra comunidad. So I'm thrilled to be here with Dr. Clark, who has welcomed us on many occasions to promote the health care of our people. And I'm here particularly when we are celebrating National Community Health Centers Day, which is the day that we recognize the federally qualified health centers, los centros federales cualificados de salud de nuestro estado y nuestra nación, the federally qualified health centers of our nation, which delivers high quality health care to the people who need it most in our communities. And it is an all-taker system. You have insurance, you're welcome. You don't have insurance, you're welcome. You're on Medicare, you're welcome. You don't have status, you're welcome. It is in one institution that says to everybody, our doors are open and we deliver high quality health care. So I appreciate Dr. Clark's leadership. I appreciate the Chief Medical Officer and what he does with all of the people at the center. When I am asked in my 30 years in Congress, what's one of your biggest achievements? It is the creation of federally qualified health centers in our state and my advocacy for them so that they will be paid the same as any other medical entity so that they can continue to provide those services that we created under the Affordable Care Act, which some people call Obamacare. I accept that because Obama did care. Millions more have health insurance as a result of the law that we passed. So that is part of what we are doing and celebrating today. But I wanted to especially come, Dr. Clark, because this weekend, some of you may have seen the news, in the United States Senate, we passed major legislation that later this week will be passed by the House of Representatives and sent to President Biden for his signature. What's that law going to do? It is the Inflation Reduction Act. It's going to help control prices so that our families don't get squeezed. It's going to take care of seniors in our state and in our nation. 1.6 million seniors are going to see reduced costs of prescription drugs. And because of the provision in the law that I wrote, there will be a cap, out-of-pocket cap for all seniors in our country. They will not have to spend, some of them spend $8,000, $9,000, $10,000 on prescription drugs. That's going to be capped at $2,000 for the first time in history. And if they need time to get to that amount, they will have a smoothing period that I wrote, so they don't have to pay it all at once. This is going to be, in addition to that, prices will be negotiated under Medicare with the prescription drug companies. That means we get lower prices for prescription drugs. And as I saw with my mother in the twilight of her life, my mother came to this country in search of freedom. She worked in the factories of Hudson County as a seamstress. In the twilight of her life, she faced a terrible disease in Alzheimer's, and she had a very large prescription drug cost. No senior in our country should ever have to choose between putting food on the table, keeping their home, and having access to life-saving, life-enhancing drugs. And this law is going to make sure that that never happens again. And that's one of the great things that we did. The other great thing that we did is if you're on Medicare and you're a diabetic and you have insulin needs, insulin can cost $100 or more a month. This caps it at $35, a third of what that cost was, and it does it forever. So no senior who has a need for insulin will have to worry about that. And for all families, we increased the subsidies under the Affordable Care Act, under Obamacare, for the next 3 years. That will mean that the average New Jersey family who is on health care under the Affordable Care Act will save about $6,500 a year. So those are some of the big health care provisions. But what else did we do under the law? You know how it's so hot and we're seeing things get hotter, and we see wildfires in the west, and we see flooding in Kentucky, and we saw our own Superstorm Sandy and Hurricane Ida. Well, these are all because of changing weather patterns, climate change. we make the biggest investment in reducing climate emissions by 40% by 2030, only 8 years away. So we can ultimately have weather that's normal, not abnormal, and that we can ultimately breathe cleaner air, because one of the provisions of the law that will pass later this week in the House and signed by the President, we live in the Port District here in Newark and Elizabeth. I just came from Elizabeth before. The port is a great economic engine, but it's also a great polluter. And so as the doctors can tell you, if you're polluting, if you have emissions, you're breathing that in, which is why we have more respiratory illnesses than other parts of the nation. This provision specifically sends money for environmental justice, particularly at ports, to change that dynamic so we are breathing cleaner air and our children are breathing cleaner air. And that's so important. So that's just one of the many provisions. We're going to save money on health care, save money for seniors on prescription drugs, have cleaner environment, and create 9 million great jobs in our country. And so that's what this law does. That's why I'm so enthused to come celebrate with you, because of what you do every day, but what you will be able to do even more as a result of this. Now, very briefly, I'm going to try to do that in Spanish. I'm going to synthesize it, and I'm not going to maximize it like McDonald's. I'm going to synthesize